In case of emergency, please find your nearest exit and exit to the assembly point, which is near to the cafeteria. So to start the symposium, I would like all of you to stand up for the national anthem, please. And now we'll listen to recitation of Holy Quran.
من الشيطان الرجيم بسم الله الرحمن الرحيم سبح اسم ربك الأعلى الذي خلق فسوى والذي قدر فهدى والذي أخرج المرعى فجعله غثاء نحوا سنقرئك فلا تنسى إلا ما شاء الله إنه يعلم الجهر وما يخفى ونيسرك لليسرى فذكر إن نفعت الذكرى سيذكر من يخشى ويتجنبها الأشقى الذي يصلى النار الكبرى ثم لا يموت فيها ولا يحيا قد أفلح من تزكى ذكر اسم ربه فصلى بل تؤثرون الحياة الدنيا والآخرة خير وأبقى إن هذا لفي الصحف الأولى صحف إبراهيم وموسى.
Dear students, Assalamu alaikum wa rahmatullahi wa barakatuh. Today I am pleased to open the functions of the College of Pharmacy Annual Research Symposium that comes this year under the theme Innovations in Pharmaceutical Research to Build a Sustainable Future for Healthcare. The Research Symposium will include keynote speeches, workshops, and students, posters and oral presentations in several interdisciplinary and multidisciplinary research projects. I would like to express my sincere thanks to our keynote speakers today who accepted our invitation to participate and contribute with their vast experience in today's symposium. I would like to express my thanks to Dr. Amna Al-Hashar, Director of Pharmacy at Sultan Qaboos Comprehensive Cancer Care and Research Center, who will deliver a talk on survey development in healthcare practical considerations. My sincere thanks also to Mr. Hamad Al-Msharfi, the founder and CEO of Data Mining Company, who will deliver a keynote speech on Istibian platform to the students and to the audience. Indeed, the organization of this symposium, this research symposium, falls within the National University's vision to be an internationally recognized university renowned for its excellence in education and research driven by social values. NU has several initiatives to support research and researchers, including internal research grants, seed funds for students and junior faculty and junior researchers, publication support and conference attendance support, and other support themes that comes under the Deputy Vice Chancellor of Academic Affairs and Research and the Deanship of Graduate Studies and Research. As you are all aware that scientific research, technology, and innovation are among the most important pillars and foundations for sustainable development, for sustainable human development, because of the fundamental role they play in identifying the growing social, economic, and environmental challenges and seeking to find scientific solutions and address these challenges. However, scientific research setup must rely on several ethical standards and several ethical considerations, the most important of which are scientific integrity and commitment to systematic research standards that are based on sound scientific plans and aim to provide impactful scientific contributions, and I would like to emphasize on the word impactful scientific contributions that advance the society. At the end of my welcome speech or my welcome address, I would like to express my thanks to Professor KPR, the Acting Dean of Deanship of Graduate Studies and Research, NU, for addressing today's symposium and for the support that they provide to all the researchers in this university. I would like to express also my sincere thanks to Professor Alka, the chairperson, and all the members of the College of Pharmacy Graduate Studies and Innovation, Graduate Studies Research and Innovation Committee, and all the members of the organizing committee for today's research symposium, for organizing this symposium with all the setup that has been done. I would like also to express my thanks to the students and to the faculty who are participating today in the oral presentations and in the poster presentations, and wish you a successful day and wish you all the best. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Prof. Khalid. And now I would like to invite Prof. K.P. Ramachandran, Acting Dean, Deanship of Graduate Studies and Research, to address his work.
Professor Khalid Al-Balushi, Dean of College of Pharmacy, eminent keynote speakers, faculty members and students, it is extreme honor for me to be here with you today because I'm pleased to note that the College of Pharmacy is coming out with this important symposium that linking how innovation could be materialized from high class and high-end research. Let me just give an overview of why innovation in pharmaceutical research is important. Because it impacts the health and save millions of lives. This is led by discovery of new medicines, new therapies, new process, new system that are beneficial to the human life and the society as whole. As a university committed to promote research that benefiting the society, we give utmost priority for the research at College of Pharmacy. I'm very glad to know that they have two important research groups, one in working in the area of drug delivery system the other in the area of the new drugs discoveries, undertaking the cutting edge research. And with the application of new technologies and emerging development like artificial intelligence and nanotechnology, in this research area, the College of Pharmacy is marking high impact of research visibility with the high-end research. And this can be evidenced by the lot of research funding they are having. In fact, always I tell 30% of research fund taken by College of Pharmacy for 6% of the faculty population of National University. It is incredible. It is not only the volume of research quantity, but also the quality of the research output they are focusing. It's a great work, and obviously, of course, they get a lot of funding, and through this funding, I do understand that the College of Pharmacy is developing and expanding the infrastructure and facilities to undertake the good research. At this point, I would like to appeal to the College of Pharmacy, particularly Professor Khalid. Let us put concerted effort in channelizing our thoughts and strategies and goals and resources to establish a center of excellence in pharmaceutical research. I think you already work in that area with support of top management, university top management, and support from all sectors and faculty and student. I'm sure that you will be able to take forward that agenda of excellence and translate this objective into reality in near future. The symposium like this is definitely a stepping stone towards and taking forward the agenda of excellence, because it creates platform for faculty and student and researchers to disseminate and discuss the latest development as well as advanced knowledge. And this will going to give the new experience, new motivation, new inspiration for young faculties and students to embark into the research. And this is rightly convened and organized, and let me express my sincere appreciation and congratulations to the College of Pharmacy in bringing out the symposium, which is very, very important in view of our Oman 2040 vision. And let me express my sincere thanks to all of you in having this platform, and I extend my best wishes to all of you. Thank you very much.
Thank you, Prof. KPR. And now I would like to ask or invite Dr. Elka Huja, Head of Pharmacy Program, to give us an overview of research activities at COP.
Assalamu alaikum, and a very good morning to all of you. And on behalf of the College Graduate Studies Research and Innovation Committee, I would like to thank our Dean, Professor Khalid Al-Balushi, for his continuous support, and also to Professor KPR, who is Acting Dean of Deanship of Graduate Studies and Research, for continuously supporting us with all the research activities. And I would like to welcome our speakers, Dr. Amna Hashir, who has been actually not only helping us with our teaching of master's courses, but she's also helping us to conduct research with their Sultan Qaboos Comprehensive Cancer Care Center. I would also like to thank Dr. Hamid for the lecture which he has chosen, which I'm sure will benefit everybody. So today I would just like to I would also like to actually welcome Dr. Talal, who has taken out time from his busy routine to be with us, and also pharmacist Rana, who has also been supporting us with teaching cancer chemotherapy courses. Thank you. I would just like to give you an overview of the research activities at the College of Pharmacy for last 1 year, because this is an annual symposium. Every time we speak about the activities which are concluded or which are happening in the last 1 year. I would just like to briefly tell you how the Graduate Studies Committee we work. NU Graduate Studies Research and Innovation Committee, which is at the central university level, and College of Pharmacy Graduate Studies Research and Innovation Committee, we report to that NU committee. And under that NU Graduate Studies Research and Innovation Committee is also College of Pharmacy Ethics and Biosafety Committee. So these two committees, they work under that umbrella of the NU Graduate Studies and Research and Innovation Committee. What are the roles and responsibilities of this committee? And it works closely with the NU committee to ensure that all the goals are aligned with the NU vision. It monitors the research of the students and the faculty. It also organizes the research development activities and continuously analyzes the feedback of the faculty and students. It coordinates with the purchase office for equipment and chemical supplies which are needed for research. Ethics and Biosafety Committee evaluates all research proposals of the faculty and students to ensure that all the ethical protocols are followed and there is no violation of the ethical standards. It also conducts teaching and research nexus workshops, and it ensures that all research proposals are aligned with the National Vision 2040. It compiles data for the College of Pharmacy for dissemination in NU Research Newsletter, ABAC, that is College of Pharmacy Newsletter, and NU Research Annual Report. It coordinates training of staff and faculty in various research institutions for professional development in research, and it also handles the consultancy projects. At this moment, I would like to thank Dr. Sumaya Al-Kindi, who has been coordinating all the activities in a very meticulous manner. She needs a big round of applause. And as Professor KPR mentioned, we have two core research groups. And one is on the development of the drug delivery systems, and second is the drug discovery and development. It is not that these two core research groups, they work independently, they are working in close coordination with each other. So now, what are the main areas which are focused in development of drug delivery systems? It is about formulation and evaluation of new drug delivery systems, development of herbal formulations, in vitro release studies to measure availability of the drug, quality control studies on the marketed formulation, and health outcomes research in collaboration with the hospitals. These are the members of the core research group 1. And in the second core research group, it is basically focused on the preclinical studies which talk about computer-aided drug design, in silico molecular modeling, design and synthesis of biologically active compounds, phytochemical screening of Omani medicinal plants, preclinical and clinical pharmacology, nanomedicine and drug delivery systems, and formulation and drug development procedures. And this core group, these are the members. and of the core group 2. And now, as mentioned, that every year we are adding new research equipments to our College of Pharmacy research labs. We are actually strengthening our infrastructure. Now, last year we added this automated tissue homogenizer and cell lyser, freeze drying machine, lyophilizer, flame photometer, and UV visible spectrophotometer. Now, just to briefly talk about the research activities in 22-23, and our faculty acted as external examiners for MSc and PhD thesis evaluation. Our faculty was also an examiner, they were also acting examiners for SKU, NISWA universities, and universities outside Oman for evaluating research proposals. Now, you can see that our faculty research activities, now almost 19 conferences were attended by our small faculty, which is only 12 people. We are only 12 members, and 19 conferences were attended. 61 research publications and book chapters were published in last 1 year, and 4 patents were granted for the faculty, and we carried out 8 research development activities for the students and 6 research development activities for the faculty and students. Now, these are some workshops which we conducted for the students, which included the workshops on research methodology and lab-based studies, databases available for research, literature review, research methodology, research and ethics committee approval, formulating aims, objectives. Before our students, final year students, they start their research projects, they are oriented to various methodologies. Then we also had a presentation on the upgrade program. And because this committee also takes care of the entrepreneurship and innovation, so we also had a workshop which was conducted on understanding the entrepreneurship. Now, research teaching nexus is a very, very important component of which matches with the NU vision and also with the vision, it is international vision also. So now, basically, for that, we conducted workshops on research teaching nexus for the faculty, and also there were 2 speakers who were invited to talk about National Vision 2040. So we had Dr. Halima Al-Hinai and Dr. Fahd Ajaddali, who came and spoke about National Vision 2040. For research teaching nexus, we invited Professor Ali Al-Badi, and who gave us an overview and how they are using this concept in their university. And then, because innovation is a very, very important thing, and Ms. Sumaya Al-Siabi, who was the winner of the Star of Science program, Qatar, she was invited by the College of Pharmacy, and where she spoke about the importance of saving the environment from plastic and how it affects the human health. She actually took us to the journey how she could manage to get the final product. Now, as mentioned by our dean and also by Professor KPR, that we are also supporting our faculty with the funds. Now, last year, Ms. Moona was awarded 1,500 Omani Riyals as the seed funding for a project on anti-cancer activity of tetradecyl benzene C20H34, which is extracted from Moringa peregrina. And Ms. Marwa Al-Hashmi is the co-investigator in this project. Now, these are the funds which we received either from our university, which comes under our NU faculty research grants, and they also support the students also, plus the Mohori, that is Ministry of Higher Education, Research and Innovation. So we got these 3 fundings, which you can see that one was from NRG and one Mohori, which was 20,000 Riyals, and one 1,500 from the URG. That is for the students. Now, you can see that this mentions about how College of Pharmacy is supporting our students to attend and present at the conferences. 12 students participated in the Dufat conference, which was conducted in Dubai. 1 student made an oral presentation also at the Oman Pharmaceutical Society. Then 7 students presented their research work at School of Foundation Studies, and 1 student participated in the Gulf Patient Counseling competition, which was conducted in Riyadh, and this competition was arranged by IHOP Conference. Now, I would also like to congratulate our two researchers, Professor Shah Alam and Dr. Mohammad Javed Akhtar, who were also selected as part of the, actually they were listed in the Stanford list of the most cited researchers for this year and in the Scopus Worldwide Database, which was issued in October 2023. And congratulations, and we are proud of you. And you can see that now MOUs were signed with other institutions for collaborative research. Recently, one MOU was signed with Abbott Laboratories. Then our research projects are closely done in collaboration with Ministry of Health and other institutes in Oman. And one of them, Dr. Sumaya is doing one project with the Central Laboratory, and that is working very closely with the Muscat municipality, and the project was also given by them because they wanted that study to be conducted. So now our college is also, some faculty are involved with the consultancy services, and they are providing services to the drug manufacturing company. Last year, we worked for almost 3 projects for that company. So this is just a small overview of what our faculty and students have been doing at College of Pharmacy. And all this actually is because of all of you. It is not a work of one person. I would like to thank each one of you for your contribution so that we could actually strengthen our research infrastructure and also contribute towards research. Thank you once again.
Thank you, Prof. Alka. And now I would like to invite Prof. Khalid, Prof. Alka, and Prof. KPR to honor our speakers. And also Dr. Dana. Dalal? Oh, sorry. And Dr. Dalal. Talal, okay, sorry. And Dr. Talal, please. Dr. Amna Al-Hashar. Mr. Hamad Al-Musharrafi. And now I would like to invite Dr. Sumaya and Dr. Shah Alam for the release of the proceeding booklet. Thank you all. And now I would like to invite Dr. Amna Al-Hashar, Director of the Pharmacy in SQCCCRC, to talk about survey development in healthcare practical considerations.
Assalamu alaikum. I'd like to thank you all. I'd like to thank Professor Khalid, Dr. Abdussalam, Dr. Alka, Professor Alka, for inviting me to give you this presentation today. I would, before even starting with my presentation, I'd like to congratulate you on all the efforts on research and the achievements as well. Congratulations on all the research funds that you have received. And when you thank me for providing all the support, I'd like to tell you that I'm equally proud of you as a college for providing all the support to your students. And I'm just glad to be part of this. If there is any success here, if I have a small part in it, I'm equally pleased and proud. Thank you very much. So I asked to have the microphone and the remote control to be able to talk while walking. This is something I like to do when I'm teaching. So what I am doing now is really, what I have prepared actually is more of an educational session rather than a keynote speech. This is what I understood from the organizers, that I was meant to be providing you with some insights into research, and this is for students' sake. To be, happily surprised that this is really a keynote speech. However, I'm honored to be given this opportunity. But I have prepared an educational session, and I think I'm better as a teacher than as a keynote speaker. So just bear with me. I will try to, take you through this session, really trying to make sense of every slide, as I said, as a teacher. This is where I work, Sultan Qaboos Comprehensive Cancer Care and Research Center. I am the director of the pharmacy there. This is my team. I'm usually careful, say mashallah. I'm usually careful. I don't want to show this to my admin and finance team in the center, because whenever I ask for additional staff, they will say, you have many. We are 70. These are not all of us, but I mean, I'm very proud of this team. Whatever success we have achieved is because of the hard work they are putting in. So I decided to give my talk in surveying in healthcare because of one of the main reasons is that this is one of the easy tools that a lot of researchers embark on it or choose it. But it's something that people get mixed up with it, like they have some confusion, slight confusion, because it's easy. It's easy, yes, but it's better done in a very scientific way if you are going to utilize it in healthcare. So it better be scientific. This is not just a simple survey. Now, these are the objectives. When would a survey be needed? How to design a good survey tool? How to select a good representative sample size? Standardized scales and questionnaires, how to validate them, test their reliability, and how to do translation of research from language to language, from a survey, from language to language. Now, the last part, or number 4 and number 5, if the time doesn't allow me, I'm happy to stop before doing them, but I will try my best to go fast in the first part, so we can still cover the last part. So what's a survey? It's a research method used for collecting data from a predefined group of respondents to gain information and insights on various topics of interest. It's very simple. It involves asking people for information through a questionnaire, which can be distributed on paper or using digital media, such as QR codes and links and so on. It is used when you want to describe the characteristics of a large population, you want to check views, you want to check awareness, satisfaction, certain behaviors. And when these answers cannot be provided by a blood test or a certain investigation, now we are moving to healthcare. Now, if a survey will be used when you can't use any other objective method. First things first, if you want to develop a survey, you want to review available research the topic from end to end. You need to have objectives that are following the SMART module. It has to be specific, measurable, achievable, relevant, and time-bound. You need to start by writing your overall goal and then break it down into small objectives. Resist the need to go to questions immediately. You have to have your objectives defined in front of you and then move on to write your questions. Stay focused, stay focused. A lot of surveys go out of the objectives because they find there is an urge of adding more questions that do not answer the objectives. Create your questions. Get feedback from subject matter experts, your colleagues, maybe a steering committee, someone who can help you with deciding that these are good questions and so on. Ask potential respondents. I will talk more about this in validation if I get a chance. So ask potential respondents. Give them, give it to 5 or 10 potential respondents. Check if this is a good, these are good questions. Pilot the survey and refine the survey to goals and objectives and questions. Allow yourself, this will allow you to address feasibility. Is it really, is this a good way to do, to get the answer? Is the survey the right way? It will give you an idea about how feasible or not feasible your survey is or questions. I'll now take you through some questions you want to avoid. So I'll talk about the don'ts, and then we will, from seeing that, maybe you will get to know the do's. So you want to avoid leading questions. Did you enjoy our amazing new product offering? Of course, the answer will be yes. Are you excited about what we'll do next? Did the nurse treat you well, in a hospital when you survey people? Are you satisfied with the great educational experience provided to you at National University? Who will say no? This is a leading question. You are leading them to say yes. Avoid assumptive questions. When you smoke, do you do it in or out of the house? Like you are assuming that they should do it out of the house. So you are giving them the answer. Do you go to the park when you are stressed at work? Again, there is an assumption here. How does our outpatient area compare to the previous one? You want them to say that it is much better than the previous one, and so on. The confusing question or the double negative. You want to avoid double negative questions. Do you think our sales team was not unhelpful? What does that mean? Not unhelpful. So were they helpful? Just say, were they helpful? Were you unhappy with the latest change that does not allow staff to use the patient parking? How many surveys you have answered had double barrel question? Or double negative, question. A lot. You spend time trying to understand what is the question about. True or false, your sales consultant was not equipped for the job, was not equipped, and there is false. So false means he was equipped. Just say, was the sales consultant equipped? Do not ask the random question. It is out of context. It is out of your objectives. It's not one of the things that you should do. It's just there is an urge for you. You want to answer. You want to get an answer. You want to see. Now you have maybe a population, students. You want to know certain things from them. It is not among your objectives, but you are curious. You want to know, do you consider yourself physically fit? What was your GPA of your first degree? What's the level of education of your parents? You want to know how many people are educated and how many people have received education, but then the objectives are not really concerned about the family of the person. Are these questions really serving the objective? Always think about your questions. Are they answering your objectives? Avoid the double-barreled question. Agree or disagree. The presentation was easy to understand and very comprehensive. Now, Easy and comprehensive is different. So answer, have two questions instead of one. How satisfied or dissatisfied are you with the pay and work benefits? Now, the pay is different than work benefits, so have two different questions. Are you satisfied with how the pharmacist greeted you at the pharmacy and the amount of information given to you? So again, greeting is a question, amount of information is another question. Now, this was a true survey. I was supervising this student, and he was having a survey on how patients knew how to deal with their chemotherapy at home. So he was having this question: هل يتم تنظيف القيء أو الاستفراغ في المنزل باستخدام الكمامة والقفازات المطاطية وغسلها بالماء والصابون جيداً? Now, this is a lot of information. Now, the answer could be yes to one of them, but is it yes to everything? So it is, you have to split this question into more than one. Ambiguous questions, try to avoid them. The response leaves room for interpretation, leads the survey taker to guess or default to whatever answer makes the most sense. Are we better than other software companies? Are we better? What does that mean, better? Anyone could interpret it differently. Are you counseled properly on your medications in the pharmacy? What is properly? You have to understand what is properly. So it opens the place for for different interpretations. Is the leaflet easy to read? Read only, interpret, comprehend. Easy to read can have different components within it. So again, avoid ambiguous questions. Avoid questions such as, how short was Napoleon, for example. This is just a joke, I know, but a lot of people do this. Was the waiting time at the pharmacy long? I mean, what does that mean? Was the waiting time at the pharmacy long? They will say yes, no. So how would you describe Napoleon's height is a better way of asking it. How do you describe the waiting time at the pharmacy? Now you can use the Likert scale, and I will share with you the Likert scale. Everyone is using that. You have to say how you describe it in different, you have to give them some answers, multiple choice answers. Should concerned parents use infant car seats? Concerned parents, you are leading them to want to be in that group. I am a concerned parent. So instead you should say, do you think special car seats should be required for infant passengers? So do not lead them to an answer. Do you always eat breakfast? Do you always take your medications? This is wrong. You don't want to ask the patient about their medication in a very casual way like this. You have to give them options, and your options have to be well defined. So you want to say, how many days a week do you usually eat breakfast? Every day, 5 to 6 days, 3 to 4 days, and so on. How often do you find it difficult to remember taking your medication? Often, sometimes, and so on. You have to give them some options. And I will share with you a scale for medication administration or medication adherence. Do not ask sensitive questions. Are you obese? Do you drink alcohol? Do you smoke? In Oman, especially, people do not appreciate this question of, do you take alcohol? Do you consume alcohol? Do you smoke? Especially females. You do not want to ask a female if she is a smoker. So if you really have to, if it is among your objectives, then do have a place to say, I prefer not to answer. Like, give them an option that I do not want to answer, if it is a sensitive question, if it is among your objectives. Avoid the words commonly, usually, often. How often do you have pain? And give defined objectives. So do not say often. What does often mean? All the time. Again, usually. These are very ambiguous. You have to give them options. A lot of us use MCQs. Consider your multiple choice questions. Make sure that there is only one answer. How many times you have answered the survey, and there were the answers were either not comprehensive or exhaustive. It's not an exhaustive list, and sometimes they overlap. The answers themselves overlap. I'm sure you have seen that. So for example, how often do you exercise? 5 to 6 days, 4 to 5 days. Now there's a 5 and there's a 5. They overlap with each other. Which one they should answer? So study your answers, study your options really carefully. Include all possible answers. Have not applicable as one of the answers. If there is a chance to say not applicable, then have it there, especially with mandatory questions. How often did you answer a survey and you found that There was no not applicable, and it was mandatory, and none of the options suited you. Many times, I'm sure you would agree with me. Use accurate scales. When asking people to rate your question, you want to offer options ranging from bad to excellent. Now, imagine I'm trying to assess how people viewed my services at the pharmacy. I avoid poor because I don't want to hear that. You know, I will maybe leave it as okay, and then go until I go to the best or the excellent services. But then I'm leaving poor. I'm biasing the respondent. Of course, all of us are using Likert scale, which was named after their creator, an American social scientist, Rensis Likert. It is a very popular way, and it is still in use. Of course, it is between 5, 7, and you can also have 9. But then, you know, 5 is the most common. So it's a very reliable way to measure opinions, perceptions, and behaviors. Let's look at, you know, how we can use it, how people feel about a service. It can be used there, what your team think about a recent development or a quality improvement exercise, how successful your event was, and so on. Anything that requires, you know, you want to measure the sentiment about something specific, instead of saying yes or no, you give them, you know, a scale. So these are some examples. I'm satisfied with the investment my organization makes. You know, strongly agree to strongly disagree. This is very common. How helpful was the content presented? Extremely helpful to not at all helpful. Very satisfied to very dissatisfied. This is used a lot, especially in the healthcare. We have a lot of satisfaction surveys, you know, because this is one of the important outcomes that we have to measure when we are providing a service. We have to measure and assess the satisfaction of the public or the users of our services. Now take a final look. Go from easy to difficult. This is not a rule. Go from easy to difficult. It really depends. Some people will tell you, keep a difficult question in the beginning to avoid that people not answer it if it's at the end. So this is not a rule, but generally people do like to say go from easy to difficult, general to particular, factual to abstract. Consider adding a contradictory question to detect the respondent's consistency. You know, sometimes people say a lot of yes, 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 yes. So put a question that will be a negative to understand if they are, you know, paying attention to your questions. Stay within your objectives. I've said this many times, but this is really important. The survey introduction has to be there. You want to state, you know, in the beginning of the survey, you want to introduce people to your survey by saying who you are, tell them why they have been chosen, state how long it will take to complete, reassure them about privacy, offer them an incentive, don't forget to thank them. So now this is an example of a survey that I have done when I was a PhD candidate. So like I'm saying here, this survey is part of my PhD research. The aim of the survey is to study your views as a healthcare provider regarding medication reconciliation at Sultan Qaboos University. You have to mention the place, the setting. You are doing it for NUST, you are doing it for a company, you are doing it for whom? You are invited to participate in this survey because you are directly or indirectly involved in the medication use process. Your views are valuable in deciding where we are now and what we need to establish a standardized medication reconciliation process. So you are telling them, you know, what benefit we will gain and what they will gain. They also share with you this public responsibility. Please note that anonymity and confidentiality will be maintained. You have to reassure them. Please also note that there is no correct or incorrect answer. The survey results will in no way be traceable to individual respondents. This survey was for nurses, physicians, and pharmacists. So I had to only send it to these 3 professions. I am not supposed to send it to physiotherapists, for example. So you need to also think about your group, how you are talking to them. Now you have to define the things that are vague or not understood. If I ask them about medication reconciliation, I have to explain to them what medication reconciliation is. So you need to define, you know, sometimes you have to put definitions in front of the, before they start with a survey, and then my name was there and where I was studying. For example, just something I just remembered, offer them an incentive. It does not have to be money or something that is, you know, tangible. It can be, especially in healthcare, it can be something as sharing with them the results of an investigation that you have done as part of this project, for example. Or offer them, or sometimes it's enough to say that this will help us understand the problem better, or it will give us, some people want to help. Just for helping, this is an incentive by itself. Try to make it short and sweet. There's a greater chance that more respondents will complete it. Offer incentives, as I said, and by a targeted audience or a panel. This is existing in some countries, maybe here. I don't know. Ustad Ahmed will perhaps tell us if we have some groups that are identified to answer some questions. So like panels or targeted audience. And try to also estimate the length of the survey. On average, it takes 7 seconds to answer an online survey question. If you keep the question simple, you can ask 8 questions in 1 minute. And why we have to make it small? What's worse than a badly written survey? What's worse than a badly written survey? An extra long survey that you do not want to complete it because it's simply too long. So try to be careful with the length of the survey and the type of questions you have. So this is again a guide. For 2 questions, you may expect them to spend more time in them, but if you have 26 to 30 simple questions, not difficult to understand, then you can have 26 to 30 questions in 9 to 10 minutes. So moving on to sample size. How am I with time? كم وقفت? Maybe I should just look at. Okay. So was I fast enough, Rana? Okay. Sample size. It is influenced by estimated number of people in the target population, on your budget, if you have budget, on the time available for you and for the respondents, and to what extent you need precision. If you just want to assess awareness about how people feel about the food in the cafeteria, you may not need a large sample size. You may just have a few people who are at maybe 20, 30, will be enough to give you an idea. But if you want to know how people feel about, for example, pharmacy services in general, you need a larger sample size, you need time, you need to make sure that you have addressed or you have seen all the visitors of the pharmacy at different times, when it was busy, when it was not busy, and so on. So it really depends. This is a calculator that can be used. It's from fluidssurveys.com. It is, again, a calculator, an online calculator. There are many, but this is an example. You have to have an understanding of your population. Like if there were 1,000 students in this college, you will have the population size as 1,000. And then the confidence level, we always try to keep it at 95% and margin of error of 5%. So this is your suggested sample size. If the population is less, before it was 20,000, now it's 2,000, it didn't differ much. So if you have a representative sample, you are okay with smaller size as long as you are careful about having a representative sample. Response rate is important for surveys. What's a response rate? You gave your survey to 100 people, only 25 answered it. That's 25% response rate. So now you calculate your sample size as the 25. So if you need 377 and you expect your response rate to be 25%, multiply 377 times 4. That's the number of people you want to give them the survey to get your 377 back. What's a good response rate? A good survey response rate is one that is above average. Anything above 25, I'm sure you have read a lot of surveys. You have seen very few are 50%, 60%. Usually response rate for surveys is not that high, unless it is a paid for, they have to answer. There is high response rates are associated with some measures that you have to implement. So at the end, an acceptable survey response rate is one that allows you to use the information collected to make decisions. So it's okay if you have a low response rate as long as it can be utilized to make decisions and it is a representative sample. So what's a representative sample? You want to have the responses coming from a profile similar to the studied population. If your target audience is 23% males but then you get the responses from about 60% from males, then there is something wrong with your answers or with the respondents. In the one that I have done when I was doing my PhD, I wanted to see, to get answers from physicians, pharmacists, and nurses. Now we had, let's say, 500 nurses. We had more, of course. And we had, for example, 200 physicians and 100 pharmacists. If we received 100 answers, so that's 100% from pharmacists, because I was at the pharmacy and I managed to, that is true, by the way, I did manage to get almost all pharmacists answer the survey. But then we had from the physicians just 20 physicians from the 200. And from the nurses, I had maybe 100. Is that a good representative sample? Now we cannot compare. I was comparing between nurses, physicians, and pharmacists' views. We have to have very much equal percentage from the three groups, from the three target groups. And we have to have a meaningful information coming out of those. Now, if you have, for example, one of the ways, I mean, to overcome this problem is to have random sampling techniques. Random sampling you will still have the problem of not reaching to everybody, but try to send reminders to the people who are not answering, and so on. So these are some sampling techniques. I will not go through them in details, but like probability sampling techniques are the random, the stratified, and the systematic for the sake of time. And I'm having the presentation is available here in the college for anyone interested. Convenience sampling is the one we mostly use for surveys. It is used when there are only few available members of the target who can become participants in the survey. I think a lot of us do go to convenience sampling, but make sure that you have, as I said, proper representation from your population. Quota sampling is similar to stratified, but it is less probability. Now, this is an example survey. I wanted to just go quickly through some of the questions. They have used the similar examples to what I have shared. They did the do's, not the don'ts. So this is a modern nurse survey. This is some questions that I will be sharing with you. Compared to 2 years ago, how has your work affected your free time? So you have here the answers. I have a lot free time, less free time. I have slightly less free time. I have, there are options. Compared to 2 years ago, how do you feel about your workload? I have about the same, less, more. Rate your level of agreement. So this is Likert scale here. Over the last 2 years, have you considered leaving nursing? Now it's a yes or a no. There are no options, yes or no. For what reasons you have considered leaving nursing? So you have given them some options, but then you have kept other. Of course, you have to give them a chance to have different answers. Moving on to standardized questionnaire. Am I okay with time? This was the part that I wanted to. It's fine? Okay, sorry, it's okay. Standardized questionnaire. Why I have decided to also talk about standardized questionnaire? Because people do mix up between them and ordinary surveys. In healthcare, we have to be very careful with standardized questionnaires. Now, it is similar, it looks similar to the survey, but it is standardized in the sense that it has to be done in a scientific way, and it gives us different type of answers. It's not just checking awareness or understanding. Some of them do check understanding, but like it is not so casual. It is more, accuracy is important here, and you need to be very careful. It is more objective than a survey, certainly. Surveys are more subjective. So examples are medication adherence scale. If you decide as a student, pharmacy student, you want to assess medication adherence in a population, don't just go and ask them, do you take your medication or not? That's wrong. You have to look for available questionnaires and scales and try to use one of them. Available validated questionnaires and scales. Why? Because decisions on medication adherence may result in, for example, if I'm a physician in a clinic and I'm using not a standardized scale with my patient, and I will tell them, are you using your medications properly? They may tell me, yes, I have an assumption now, or I will believe them and not do anything about their treatment. And they may say no, and I may change their medication. So decisions are taken based on these questions. So we have to be very careful. As a researcher, you have to be very careful when you are using a medication adherence, a validated questionnaire, or in terms of medication adherence or others. So examples of these are medication adherence scale, asthma control test, health literacy, anxiety rating scale. Anxiety rating scale, you give them medications based on this answer. So you have to be very careful about using these standardized scales. This is asthma control test. Again, you will verify this with some tests, but then you may change your treatment for asthma based on the results of these questionnaires. Now, this is an example of a medication adherence scale that is validated and standardized. These are the questions in Arabic. هل تنسى في بعض الأحيان أن تتناول علاجك الخاص بحالتك الصحية? Why الخاص بحالتك الصحية is between two brackets? Because this questionnaire is validated for hypertension initially, and then people try to validate it in other conditions. So again, you have to be very careful when you use a certain adherence scale in a population where it was not studied in. So as I said, the reason for all this is I'm trying just to give you this idea that maybe you have to read about it and try to find something that is validated and standardized. So this is something that is developed and has been, as I said, standardized and validated in certain health conditions, and it was also translated to certain languages, and once it was translated, it had to be validated again, and so on. So if you decide you want to do a standardized, you want to develop one from scratch, you have to research, and decide, do I need one? Do I need another one? How many times, Rana, did we go through? Myself and Rana, we are members in the Institutional Review Board, where we review some research proposals. How many times we have seen people coming up with ideas about scales which are existing. They are available there. They just need to validate something that is existing. Do we need another one? Is this scale just a Me Too scale? Translate and validate an existing one, that's better. And validate against the gold standard. Try to validate something against the gold standard, and we will come to this in a minute. So we have to look for validity and reliability. What's validity and reliability? Validity is to the extent to which the scores represent the variable they are intended to. So if we have questions that say, medication adherence questionnaire, what is the validity of it? If it measures what? Medication adherence. So it will be valid if it truly reflects medication adherence. Reliability is consistency across time. So it is test, retest. If you redo this test, is it going to give the same results? Across items, internal consistency, or across researchers, if I'm doing this test and Rana is doing for another population, are we getting the same results? This is level of agreement between me and other raters of the same scale. So what's validity? Again, it's an assessment of whether a measurement scale looks reasonable, is directly related to the respondent's acceptance of the text. Sorry, apologies, I did not see the title. So validity, I'll start with the first type of validity. It is face validity. They call it face validity. So does it look good? The scale itself or the questions. Face validity is also applicable to surveys. So it is really just take a look at it. Does it look fine? From the outside, questions, is directly related to the respondent's acceptance of the text. So there's no statistical test required here. The more people, the different groups, the more acceptable it is likely to be. So just test it among colleagues, potential respondents. Does it look fine? And so on. Content validity is a little bit different. Now, you want people to read the questions in the scale. Has it included all the relevant issues and excluded all the irrelevant in terms of its content? And this is usually assessed by a peer review, critical review by an expert panel for clarity and completeness. Or compare it with the literature, what's in the literature, or do both. So this is content validity. We are looking at what are the different questions. Criterion validity is something else. Criterion validity is two types, concurrent and predictive. So what is a criterion validity? Criterion validity is comparing the scale being developed with a criterion measure that has been established as valid, either concurrent or predictive. I will give you examples, it will make it very clear. Concurrent is the extent to which a measurement scale under development correlates with the gold standard. Both are compared at the same time. Let's look at predictive. I'll go back to the concurrent with examples. Predictive refers to the ability of the test or other measurements to predict a future outcome. Outcome can be a behavior, performance, or disease that occurs at some point in the future. For example, a pre-employment test has predictive validity when it can accurately identify the applicant who will perform well after some time. For example, you do a pre-employment test and you do it after 1 year. Have they done well? Not have they done well, have they done something that correlates with your initial test of them? If the initial test was showing that they are not very good, and then they were not very good in the future, then that correlates well. It has a good predictive validity, and the other way around. So example of the criterion validity, whether it is predictive or concurrent, is, for example, the medication adherence. We spoke about medication adherence scale for patients on warfarin in correlation with what? INR. So we do INR, and then we do medication adherence for patients on warfarin. INR is a gold standard for patients on warfarin. Do you agree? Yes? So we test, we check, we correlate between the two. Are my INR results can correlate well with my medication adherence scale? For example, diabetes patients. What's the gold standard for assessing patients' control of diabetes? Hemoglobin A1C. So we do hemoglobin A1C, and then we correlate it with medication adherence for diabetic patients. Asthma control test, again, with pulmonary function tests. So this is something that is done in radiology department, for example, or clinical physiology, pulmonary function test. The results are correlated with asthma control test. They correlate well. This has good concurrent validity. In a college entry exam is correlated with a GPA after 1 or more semesters. What is this? Predictive validity. So you are predicting, is this test able to predict what will happen in the future or not? Reliability, on the other hand, it measures the test consistency. The reliability of a test measured over time, it is the reliability of a test measured over time. So you give the test twice to the same people at different times to see if the scores are the same. For example, you test it on Monday and then again the following Monday. The two scores are then correlated. So it is reliable. It has to be showing the same. We use Pearson correlation coefficient, and the findings, if it is between 0 and 1. So 1 is perfect reliability. It goes down to 0 where there is no reliability. Again, we give the test to 2 raters if we want to check the inter-rater reliability for questionnaires in which multiple raters have to do it. Like I have a survey or a questionnaire that I will be doing with 3 pharmacy colleagues. We have to test if we are measuring the same, getting the same results from the same person. So the extent to which raters are consistent in their observation across the same group of examinees. So we are doing it for the same group of examinees. Each one of us should get the same results. And this is, we use kappa statistics, where again, it is from 0 to 1. Kappa, if it is 1, it is the best, and if it is 0, it is the worst. Internal consistency is something else. Again, internal consistency is an assessment of how reliably, reliably the tests are designed to measure the same construct actually do so. Again, with the example, you will be able to understand what is this. It is used to assess how well the different items measure the same characteristic. Cronbach alpha is used as a test is used, and I think Ustad Ahmed will share with us how we will maybe implement some of these tests. I'm not sure. Okay. So it is one of the tests that is available in all the softwares that you will be having. Now again, it is the same from 0 to 1, with higher level, 1 is high, is best, and 0 is worst. And this example will explain to you a little bit what we mean by internal consistency. For example, a bank manager wants to assess customer satisfaction. The manager asks customers to respond to the following 3 statements using a 5-point scale to denote their level of agreement. 1, I was very satisfied with the service, so 5 points. I am likely to buy from your company again, 5 points. I am likely to recommend your company to others. If the responses to these items are internally consistent, then there is evidence that the items measure the same construct of customer satisfaction, or the other way around. Now, what do we mean? If I am a respondent, I will say I was very satisfied with the service, but then I answer I am not likely to buy from your company again. This shows that there is lack of internal consistency. There is a contradiction between the components of the scale themselves. Last but not least, this is the last point that I will discuss, translation of a questionnaire to another language. As you know, for Arabic language, we do a lot of translation from English to Arabic. So we have to do it carefully. There are protocols for translation of questionnaires. Translation of an existing validated scale protocol, you want to do it, you want to test it. It's a nice research proposal, by the way, for students to do a translation for a certain, this by itself is a research project and it's a publication on its own. So you do a forward translation from, let's say, for example, from English to Arabic. So you will have to do from English to Arabic, preferably by two independent translators. One is naive to the objectives of the questionnaire, and preferably both translate to their mother language. If you don't have native English speakers, you can have one and one. One who is not native, but he is good in translation. One preferably is native. Now, and one of them better not to know the objectives. One of them it's okay to know the objectives of the scale. After doing that, so you go back now from Arabic to English, preferably by two independent translators, preferably back to their mother tongue, preferably both naive to the objectives. Now, you want to see that the backward translation is giving very similar to the original questionnaire. If there are discrepancies between the translators, it can be discussed, and they say we have to do reconciliation between, or resolve the discrepancies between the two. And then you have your translated version. That's all from me today. I hope I didn't bore you or I didn't take long time than needed. Thank you very much.
Does any student have any questions?
Validation is only required for questionnaires that have to be standardized. As I said, that need to be objective because you will take decisions. It really matters. But for ordinary questionnaires or surveys, not all of them require validation. Now, for those that require validation, no, we don't have a committee. It has to be done by the research group itself.
What is the procedure you use in the hospitals for validation of the questionnaires?
Validation is done by research groups, not by users. So if you are doing it as a research project, validation by itself is a project. So usually, for example, for a PhD project, let's say, they will start with validation, translation, validation, and then they may be able to use it in another research. It's a series of projects, not one. So the user, let's think about it in the context of pharmacy students.
Yeah.
Does it require validation? Give me an example.
Example for a master's students or for a bachelor students, when they do survey studies, so they prepare a questionnaire and they also translate from English to Arabic, they do that. But that questionnaire is not validated. It is only checked by the supervisor or maybe 2 or 3 people who are examining. They just give some suggestions. So is that enough, or do we need to form some special committee to validate the questionnaires in future?
It's enough if it is a questionnaire that, as similar to the examples I gave, you are checking the awareness about something. you are trying to understand the population opinions about something, you know, related to pharmacy, let's say. But you are, if the answers are going to make you take decisions that will affect the patient, like the examples I have given,
Yes.
then you need to validate. But if you are not, if a lot of these for example, the survey that I've done, the medication reconciliation, does not require validation. Why? Because I am only trying to understand the awareness of nurses, physicians, and doctors on the medication reconciliation as a principle, as a concept. So we do not require validation for that. If it is available out there, we have to take permission to use it and translate it, for example, if we are going to translate it to another language. Now, if it is translated to another language, if we are talking about healthcare professionals, I don't think we have to be very, very careful, you know, not the same translation protocol. But medication adherence, for example, we have to follow the same translation protocol. Like, for example, the medication adherence that I have used. A number of research teams in the Arab world have sat together and translated the same scale. And they had different versions.
Yeah.
But then they were going back to the developer, and then he then decided to deal with a company in France to look to take care of all the translation efforts, so not a lot of people will translate it. Another example is for translation that it requires all this is quality of life. Quality of life questionnaires are very important. They need validation. They need validation. Quality of life questionnaires totally require validation. But if it is something, as I said, you are trying to understand the understanding of people about certain services, or about if it is, you know, I don't know the examples you are referring to, and you may even develop the questions yourself. You don't need to you don't need to use something from the literature. I'm suggesting that use something from the literature if it is something that by doing it yourself you may lose some validation
Important points,
efforts that
yeah.
have, yes. So it really depends on the
So
type
are
of
there
survey.
any surveys which are available, which are already validated, you know?
Yes,
So
yes, a lot. Like this, the medication adherence questionnaire is validated in many languages.
So it is already available.
And more than this, there are
Medication reconciliation and medication adherence we have seen, because when we did a project, we used what were the validated surveys.
for example, the medication reconciliation.
Yes.
It does not require validation. It does not require validation because you will not take decisions. You will only use something that is existing.
Response.
And
yeah.
then you will, maybe the advantage will be that you are trying to, maybe when you publish it, for example, you will compare between your findings and the previous findings. So that's the advantage of using somebody else's questionnaire. But if you have your own questionnaire on medication reconciliation, you will be able to do it well. You don't need validation. You are just saying that I am checking the awareness and getting an insight into what people understand about medication reconciliation, and you are publishing it as such without comparing to any
other study.
Yes.
Okay.
So validation really is important for questionnaires that will result in you taking decisions or labeling the patient, especially for patients, labeling them. Students say that he is needing additional help. You are labeling them by having educational difficulties. This needs validation.
Yeah.
This
Oh.
needs very strict validation. But something else that, you know, in a school they want to understand how
The
they will not
behavior
label
or
them.
their
They will not
awareness
label them.
level.
They will not take any decisions against them or with them or to support them. Then that is the
Okay. Thank you. Thank you so much. Thank you.
And now I would like to invite Mr. Hamad al-Mushrafi, the founder and the CEO of Delta Mining Company.
Okay. Sorry, I consume a lot of time. Anyway, I would like to thank the faculty, and this is just to register. This is the form. This is the form. All of them, all of you, please just scan it. Can register. Okay, it's okay now. It's okay, fine. شكرا جزيلا. Yes, it's okay. Yeah, excellent. So today I would like to thank دكتورة على المحاضرة. حقيقة it's very good. It's remind me about a lot of things that I have done before. Now we are, in fact, doing different research. Anyway, I was, working in Ministry of Health before, and in research department, by the way. Yeah, I have done a lot of research in vitamin A deficiency and birth spacing and many research. Anyway, and she reminded me with a lot of things here: reliability, validity tests, alpha Cronbach, and other things, which is good history. I'm doing now, by the way, but not that much. So I would like just to introduce all of you. Take take this one. Okay. I would like just to introduce my my lecture today, or my talk about the what's called it. Oh. Okay. Introduction about the questionnaire design and data collection. Okay. This is the contents. Introduce data mining, then main areas and services we are provided, practical experience and previous work we have done, and we will introduce one of our product, which is Symposium platform. Symposium platform is similar to Google Form, Question Pro, SurveyMonkey, but this is local developed. Okay? This is local developed, and it contains some other features more advanced than Google Survey. Sorry? It's for researcher free. No, don't worry. Yeah, for researcher we are supporting researchers. So this is our main areas: economic and social consultations, data analysis, and building performance indicators. We have team for programming team. We have call center, by the way. We are conducting the surveys using call center phones. Okay, so if you have phone numbers, we can contact them. We can contact them through our call center. Okay, these are the main areas. Also services, data analysis, data cleansing, Symposium platform, call center. All of us, we need data. We are here data, how many people, how many male, female, how many students, how many faculty members. Data. The world is data. So we are doing data analysis. We are cleansing data. If you have a data not cleaned, we can clean it using our methodologies in data cleansing. Also, we have to collect data, collecting data through our platform. When we conduct the surveys, we are using our platform. Everything is our platforms. So also we can do the call center. These are some experience that we have done before. All of you knows about 2040, and you spoke about 2040. 2040, it comes from Tanfeed program. Okay? We were one of the companies we are participating in doing the Tanfeed program. We designed a questionnaire. Okay? We collect the data electronically, no paper. It was in 2016. And then we analyzed the data. We wrote the report. We put our recommendations. One of the recommendations is education lab, ICT lab, oil and gas lab. It's done by the government. Okay? Also here, municipality fees. This is in 2018. They increased the fees by 500%, 1,000%, 6,000%. And then we came in between that we have to, before we force the people to apply these fees, we have to see the socio-economic impact. What are the socio-economic impact for these fees? So we have done good work here. Accordingly, the government freeze this decision. See how we are influencing the decision? This is the data, how to influence the decision. Even in pharmacy, you have to take a decision. What type of decision? You are collecting data, making questionnaires. All of this, you have done all of this stuff. By the end of the day, you have to implement one decision. Am I right? Okay. E-census, the last e-census, 2020, we are part of it. Okay? I will not speak much, but we are part of it. For data cleansing, as I said before, for data collecting, for data analysis, to produce such tables that you saw it in the census. Okay? You know the Sustainable Development Goals? You know it. SDG. SDG 2030, and it contains 17 goals, 169 targets, 144 indicators. Am I right? Okay. We have done for 21 indicators which are related to FAO. Okay? Food Agriculture Organization. We have analyzed the data for this in 2019 to assess the situation in Oman. Where are we exactly to reach 2030 according to the SDG 2030? And then we wrote a report. And we end up with some recommendations. We gave it to Ministry of Agriculture as well as FAO, Food Agriculture Organization. And then one of the recommendation is to train the people who give the data to these organizations, because we found that our data in FAO is wrong. We prove it. And then we have to teach the people how to calculate these indicators. Out of 21 indicators, we trained them for 17 indicators, and we brought 5 expertise from FAO just to train the people for 1 week. And many people comes from SQU, from different kind of ministries. Okay, I will not go through this one. This is one of the things that we have done also. Survey measuring satisfaction, as Dr. Said before, satisfaction. Measuring employee satisfaction. Privilege of entrepreneurship card. How is it benefited or not? A lot of people, they have the card. So we send a link through our platform. Opinion polls. This is very important to support the decision makers regarding the public policies. Okay, are we going to validate our questionnaire or not? This is a different issue. This is the product, and this is the main topic for today. That one's only introduction, but as I said, the data or data analysis leads you to take a decision. If your data doesn't, leads you to take decisions, that means you are doing nothing. Just only collect data, make tables, and that's it, which is not the case. Okay, this is some clients, some of them partners. Okay, this is for the contact. If anybody wants to contact me, my email and my phone number. Let me go here. Let me start to do, this is our platform. This is one of the questionnaires that I have done. This is only for practice or for, see? Our platform is, you can make four languages at the same time. Here is Arabic and English. All of this Arabic, all of this English. You can see the questionnaire, this small one. Okay, I will enter some data here to see the features. Here, Omani, male. Age here you can see. Can you see here? You can make, if I make 1, 2. Can you see the message? This is type of data validity, by the way. Am I right? This is type of data validity, to make sure that your data is right. While you are doing the analysis, you will not face a problem. We have extreme values as big or extreme values from both sides. So what you will do for extreme values? Are you going to teach, how you will going to deal with them? Delete them? Delete whole record? It depends. I'm not going to, take it here. If I say, for example, here bachelor degree, and then you can do the date by immediately from the system, you can change it. Okay? Have you heard about Stibian platform before? No. Wow. I heard them, in fact. I will say yes. So, see how it, this is the Likert scale, she said before. Likert scale. We are on the same way, same picture or the same way. Anyway, you heard about Stibian through newspaper, through data mining website, through my organization, or this is called multiple choice, more than one. Okay? I heard, in fact, from social media. See this? If I hear from social media, what happened? I can see. Through which of social media you heard about Stibian? Please select 2 and rank them. Have you seen this in Google form? Select 2 and rank them. Okay. I will select 2 and see what will happen. Instagram, Twitter, and I will rank them. This one 1, and this one, for example, 2, nothing 3. I rank them. Okay, and then I can make the Likert scale, 5 Likert scale. She said we have 5, we have 7, we have 9. Am I right? Yes, we have 5 Likert scale. I'm always against this one in the middle. it will give me wrong answer, especially if you have a big sample and then it is in between. It's neither here, neither here, neither here. Or neutral. Let me say another, please remember the answers. Newspaper, social media, data mining. Last one is my organization. Remember Instagram, Twitter, WhatsApp. Last one is Facebook. Remember them. Second one, he entered to my link. Another one, enter to my link. And then he said, yes, I heard. See how the, have you seen the order? What happened for the order? Changed. Do you know bias? You heard about bias? تحيز. This is bias, to avoid the bias. Sometimes he will read the first one. Okay, he will read, but he will put the first one or the last one. To avoid the bias, you can make this, see social media. Maybe not change. Same. Okay, see now. Another one. Yes. Social media at the top. See now. Each one will get different orders to avoid bias. So you enter this data here. All of you, for example, I don't know how many he entered the data. Just, yeah, it's okay. I will, they enter the data in this one. Okay, what is this one? Okay, okay. I'm taking the data now, all of this from the server, not from my computer, by the way. The data is, you see here, everything you see here, not from my computer, from the server. Directly from the server, hot. So you can see it takes some time just to open, to bring the data from the server. This is the link here, this one, sorry, this one. This is the data that we have in this one. So we will bring the data, we will see the data, how it looks like. This is one of the features, by the way, but I will not explain it now. This is feature by itself. So this is your data, till it comes from the server. How many people answered this question? 9,799. Okay? All of them online, nothing offline. We have also ability to make this questionnaire offline. If you have data, just plug it. Offline. You can do offline data, by the way. The average, she spoke about the time for the questionnaire. See? The average, 15 minutes. 15 seconds, sorry. 15 seconds. And all of them in English. This is dashboard. So I have this data, okay, we will do this. While the questionnaire is going on, I can see my data daily. I can see my data now. If there is anything once wrong, I can immediately interfere to correct the path. Okay? Let me here see education level. Okay, this is the education level. This data. I can do here. I can change this one to pie chart, to bar chart. What you want? I can also make, she said, Likert scale, like she said, alpha Krumbach or something like this. Descriptive analysis. Descriptive analysis, usually numerical one, age, number. If it is, for example, yes, no, 1, 2. If it is, make the Likert scale as 5, 4, 3, 2, 1. Okay? You can make, if it is numeric, you can take the average. Yes, analyze it, you will see minimum, maximum, average, and standard deviation. Maybe next time we will develop Alpha Cronbach, we will develop something. Yes, it will be in one place, all the analysis in one place, but we will take time. We can make those tabulation table, by the way. Here, for example, education level, I will take gender, I will take nationality. Okay, have you seen this one before? See here, we have all these questions. Nationality, gender, education level. Can you see them? So now we will just make the analysis. Okay, I will take this one as here. It's almost here, bachelor, general diploma, master, PhD, whatever. And then I can add another one. Gender, for example, it will be distributed already. Finish table. No need to take 9,700 to Excel or to SPSS or SAS, whatever. It's because you are doing daily. You can make your data, check your data daily. Okay? You can also add another variable. Omani and Omani, and then you can add as much as you can, unless it's, it should give you meaning. Okay. Let me go back here. I am using more than one. Anybody can give me his phone number? Any volunteer? Yes. 99351322. Can you see something here? Huh? It's in Arabic, by the way. Sorry, I gave the example in Arabic. But she cannot enter into this form because this form only for the faculty of College of Pharmacy, or this questionnaire then for students who are in 3rd year or 2nd year. I make it as blocked. Even this form went outside, nobody. This is for data validity, for make sure that the data is correct, to increase the efficiency of results. Okay? See, now I will take this number, copy this one, I will put it here. She will register with me. Paste, listen. Doctora. Oh, sorry. صح؟ Okay, Doctora, do you have your phone number? Your phone? See your phone. Tell them what you have seen. Yes, what you have? She got an SMS immediately after she submit this one. So our system is provide SMS as well as emails. Okay, now you are registered with me. I know you. You are one of the sample that you have to answer my questionnaire. Okay, see now. I will refresh this one. I will put your number again here. What happened? Your data comes immediately. I didn't enter it. Am I right? I didn't enter anything. Your data is here. Okay? I will go next. You can download, instead of giving, for example, description about your survey, 2 pages, 3 pages, 4 pages, instead of put it in the survey itself, you can put it like Google Drive. You can put your file, whole file, 50 MB. Is very books, not book. We put it as a books. You can download it from here. See this action? This is called which of the country are from Africa? China, UK, Indian, nothing from above. Which of these countries are from Africa? China, British, India, none of the above. None of the above. See the last one, none of the above. If I select none of above, what will happen? To avoid the contradiction. Okay? To avoid contradiction. It is not easy to, this is because this one is not single choice, this is multiple choice, different. I can select 2 and it will be correct. Okay? If I say here, have you visited Musandam, Dhufar, Al-Wusta, everything, he said all of above. All of the above will be clicked. Okay? I can upload videos. I can put video 50 MB. And then you can answer your questions. You can answer the questions after you seeing the video. Okay? Also here I have another one. This is questionnaire. Similar to, I can record, make the recorder. Assalamu alaikum, Sajil. Assalamu alaikum, wa alaikum assalam. We are here in College of Pharmacy. See? I can run it. See? These kind of things, in fact, we have done it. We have put it in our platform just to make sure all type of data, you can collect all type of data. Not only just yes, no, and to make the questionnaire interactive. Once you see video, some of them questions and then videos and then questions and videos, the people will encourage them. Incentives. Okay? Okay, this is Ministry of Health. Oh, Ministry of Health. I have done this for Ministry of Health, in fact, while we are discussing. Okay. Please scan this one. Scan it. And don't make submit. Don't make submit. This is in English. Don't make submit. Just scan it, answer the questions, see number of boys, number of girls, and then see the total. Please, all of you, I want all of you. Yes. Any name, it's not necessarily your name. All of you, take the scan. Okay. Don't submit. Just let me check first, and then I will tell you. Oh, let me check first. Okay. Let me check. If it is this way, all of you will stop, because you have more than 10. You have seen your questionnaire. First is from 8 to 9, something like that. 8 to 9, 9 to 10, 2, it's coded. The answer is coded, no need for coding. Is already coded. I put 1, 2, 3, 4, but in yours, 8 to 9, 9 to 10, can you see that? Choose anyone and submit now. I'll see here. Submit. All of you submit. Submit it. 290, I would like to see. 124, 110, 56. Let me see. Wow. All of you comes live. This is live dashboard. You can see your data if we have a lot of people, just making the submitting. See 17, it goes up. This is live dashboard. It's provided by live dashboard. While you are in the office and you distribute a questionnaire, you can see it. Just open the screen and see it. See the result without. Okay? This is called live dashboard. You have a ceremony or workshops, and you have parallel workshops in 3 rooms, 4 rooms, or you have a training, providing a training, 3 for during, this month or 6 months, you have 4 programs as a training, and then you need to specify this one, I need 20, this one I need 50, this one I need 30. So according to the rooms that you have, for example, workshop, only 30 people should register for XYZ program, 20 people for T13, and 50 people to register. Once you reach the limit, this one will disappear. Let me see, I put 1, 2, 3 only, just an example. I will select the first one, this one, the R3. Okay, put any name, okay? See now, you will see only 2. The third is limit, reach the limit, 50 or 20. It will not come. Once you reach the limit, that because this room only for 50 people. Suppose they register 60, you will apologize for 10. Please, we don't have time. We don't have place. Am I right? But this one is solve your problem. It could be workshops, it could be a program, it could be training, whatever. You have to just set the limit and forget. Okay, you got it? I will not look at this one. Yeah, you can make the certificate. Yes, online certificate. Okay. أنا بحط الدكتورة سمية صح؟ هاتف أني رقم حتى رقمي أنت فاين أني رقم سمية الكندي أو الدكتورة دكتورة What's going on? Net جماعة net What's going on من net أول ما عملت دكتورة صرت كذا anyway عشان عندك سلطان don't make it لا تشيله بس كذا connected عندي أنا أوكي اتصل عندي أنا ليش خلى كذا يعني اوكي ثانك يو انا حاسفين احنا اول ما عملنا سميه كذا حاف قال لي لا you should have to اعطي designation right اوكي واو مبروك سميه خلاص تحصلتي على اوكي Yeah, by her name. signed, stamped, everything. No need for papers. Okay, no need for papers. But this link will be, anybody can see the link, this one, and he can make what's called it certificate for himself, because there is no restriction here. But here, see here, for example, there I put restriction for the certificate. No, but not everybody can download the certificate. So all of them, you see, block them. Name and email, it's blocked. Only he will enter his phone number. Once he enters his phone number, all the things will come automatically. 99384453 comes automatically, because I attend this. So I will once I mix. I mean, this is another type. Okay, you can produce your certificates. Okay. Then here. وانا قاعد اعطي الامثله وقاعد اعطي الامثله وقاعد اربط محاضرتك. Anyway. شكرا جزيلا. Anyway. I will not. I will try to. How can we create a questionnaire using platform? This is the most important for you. Now I explained some features in Symposium platform. Now I will create a form. How it will look like. Okay? Let me create a form using Symposium platform. So once you open Symposium platform, you will have two things here. You will have two things. You will have surveys, okay, and analytics. Okay, can you see that? Two things, you have surveys, forget about admin, this is mine. You will have only two, surveys and analytics. Once you click here, there is something called, okay, before that, let me okay, do something here. Okay, let me. Please, this one I have translated using Google. Please, no, but don't blame me if there is something wrong. See how, what type of language do you have? Can you see them? You have English, you have Arabic, you have Hindi, you have Urdu. See? Yeah, I will add Chinese if you. Yeah. You want, if any language you want, just let me know. I will add it. Okay? So in this case, I will switch to English language. See? I will switch to Hindi. Please don't read because this is my translation. This is Urdu. I will turn back to Arabic. So that you can, what's called it? You can create one questionnaire, you can make it multiple. One person, he will ask me how the data will be using for languages. Am I right? How the data will be using for languages. It will be one language only. It's created in Arabic. This, for example, gender is male, female. He will write male, female. All the data will be in Arabic. Instead of gender, male, female, it will be dhakar untha. All the data here will be in Arabic, one language. Even you entered using other languages. It's different than Google Form, by the way. Google Form, you have to make together and then 3 languages together. But this one, you can just shift between the languages. Only the issue here, if you have open questions, because he will write by his language. But try to make it categories. Multiple choice, single choice, drop-down list, whatever. Okay? So we have 4 languages. These 4 languages, okay, Hindi, Arabic, Urdu, let me go here. So as I said before, we have two things here, surveys and analytics. To create a survey, just create a survey, new form. This new form will come. A new form with the names. For example, here, I will make it College of Pharmacy. Pharmacy. Okay? And it will start today. And this only these three you have to specify. Survey name, end date, and start date. And then you can go here to the body and drag them. Drag here, name. That's it, name comes. Okay, then age, okay, this is number, age is number, age. That's it, you create the questionnaire. Then gender, single choice, drag it, gender, male, female, data, male, female. And you can put male, you can put 1, 2 if you want, values, code it immediately. And you can also not code it, depends on you. No, I would like to make it male and female, no issue. Male, female. This is the questionnaire is ready. Then I have to put it, this one required at the start, validation. Required, where is Doctora? Validation. Okay. Required, and I will make the age. Minimum age is 15 or 20 up to 40. Then you can make the message. Please enter the age. Please, the age should be in the range of 20 to 40. Save. Gender also, I want to make it as required. That's it. Create. Create. Yeah, I will give you now. Just, yeah. Create. The name is called pharmacy. This one, you can see QR code. Finish. I will copy this one. I will copy it here. Copy, enter. See, this is yours. I will put here, for example, 15, what the message I got. صح? Have you seen the validation? Okay. Now, I'll give you an exercise. Some of people, they want me to make their trial 4. HAMED. I would like to see if there is a data here. Oh, some data here. Huh? Okay, only 2. Only 2. I can't give you this one. Let me check this one, what is inside. Oh. Okay, you can enter to our platform. No issue. You can enter. Nothing here. Using the things, you have to type this one. HTTPS at the top. You want me to put it here? Okay. Copy. You can type this one. In your computer. Okay. Then you will get finish. 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 Yes. Yes. Now I will give you a username and password. Right here. Finish. Yeah. Trial 4 at this one. Okay. Finish. This is the password. It will be changed, by the way, after 1 minute. It's better to bring your computer because it's easy. Oh, what's this? No battery? Yeah, it's okay. You can use your computers better quickly because you have to. Now, mobile is not app. It's not app, but it's compatible with the phone. All of you enter? All of you? No? Yes? دكتورة خلاص? I'll give you another account maybe later on, just to exercise, to make exercise. If there is anything, if you need a workshop, extra workshop, let me know. Even online, no issue. خلاص؟ الحمد لله. كلكم خلاص؟ Finish, over? Can I start? Finish. Bismillah. Oh, this is yours? It comes this way. Surveys, analytics. Am I right? Yes. You can go surveys here, create a new one. Create a new. This screen will appear. You can make by language, any language you want. Now we have 4. We will make it in English. You can give a name, any name. ما في بس. Okay. Give any name. I will make it pharmacy. Pharmacy 1. Okay, after you enter survey name, you can go and enter the date, start date and end date. Any name, your name, any name. Later on you can change the name, no issue. Survey type, don't forget about. Only these 3. Survey name, start date and end date. That's it. This is the essential. Without them, you will not proceed. You will not be able to proceed. Okay? And then go down till you get this screen. Down till you get this screen. Yes, no, don't create it now. Just go down until this one. Okay? All of you in this page? All of you in this page. Then you have here the type of questions. See, basic, advanced, layout, file. I will make basic, and then I will put the name. Just see here with me, please. Just click here and drag it, drop it here. Where above the submit, not underneath, above. And I will make here name. I will write name. All of you make same and then save. That's it. Finish? Single line text, because name is single line text. If, for example, if I say, please give your observation or give your opinions, I will make multiple line. I can enter and then I can make enter double lines. Okay? You make it required. Validation. Wow. Then you make create. Press create. Yeah. Create at the top. Just one. Nam. Yes. Again? Drag it there and put name. Okay, again, I will do it again. I will do it again. I will do it again. See, from here, I have remove, copy. Okay, I will see, I will just drop it, drag it. I will get a screen. This screen, the label. I will make the label instead of this one single line text. I will make name. That's it. Save. Yeah. عندك سؤال كان. You have a question, please? Okay. What you want me to say now? To start from the beginning? Okay. خلاص? Finish? Then I will make create. That's it. Create it. With one question only. You wrote your name? Under label, you wrote your name? Okay. I will tell you. The name is a variable. It could be any name. Not your name. It could be any name. The variable name is called name. The variable is called name. Okay, let me see how many created. How many of you created here? Oh, mashallah, mashallah. Who is this one research and at college? Yeah, you. I will take this one. I will see what she has done here. Okay. Why? Because you took a date. You have a problem in date. See, I will enter. I will see your problem. See. I need this type of mistakes. See here what she has done. She put it 8th and today is 7th. It should be open on the same date. You have to change it. Who else? Pharmacy. Okay, let me see pharmacy. Existing. How can I? Oh, Bosch. Who is Bush? Bushra. Sorry. Bushra. What happened? Bushra. Okay, ممتاز بشرى. بشرى؟ وين بشرى هذا؟ Yes. Sorry. ممتاز, but you have made a mistake. Can you see your mistake? Submit is underneath. And submit أول يعمل submit. Just drag them up. How? I will show you. Good. This kind of small things, it will make difference. I will make here. See yours. Bushra. See how I'll make them. Just from here you will see edit, remove, copy. Here move. I will move them up. I will move them up. Can you see? Only move. You are using your phone, so that is difficult. Okay, I will create for you, no issue. I will create for you. Another one. Let me see who else. Labs. Who labs? Oh, labs. Let me see. master lab here. Oh, ممتاز, fantastic. But make it required from validation. Make edit, go edit, and make it required. Star, you know, red star. Okay, who else? Pharmacy. Pharmacy 1, pharmacy. Who is pharmacy 1, 1? First one. Sorry? Ah, good. Then make age, make whatever, make one, make gender, for example, make work status. I'll tell you how to make conditions. Make one. Continue. Which one mine? Pharmacy 1? How many people making pharmacy 1? 2? Which mine? This one? والله ما أعرف أنا. ما أعرف من هذا أعطاني نفس الشيء. Let me check this one. This is closed. That is not mine. عرفنا. This one mine. Pharmacy 1. 28. Okay, instead of pharmacy 1, I will make it pharmacy 1, 1. So I will make different. See here what I will do. Name, and then I will make edit. See, edit. And I will make validation required. Then I will make, for example, here, gender. Gender here, the data, for example, single choice. This is single choice, male, female. The data in the Excel sheet or whatever, it will be 1 and 2. Okay? And I will make another one. This one is, I have to make it, for example, here, edit, and then required. I am maybe so fast anyway, but here, for example, I will make working status. Working status. Okay? This question, working status, has 2 variables, working, not working. Working. Okay? Not working. I'll put here working, same word here, capital letter. Working, not working, copy. Okay? And I will ask him a question here, another question, and required. Yes, and then sector. Single choice, another single choice, and sector. In which sector? Government, gov, and gov. And private. Okay? Gov, copy, paste, copy, paste. Validation and validation required. Okay? And then I will make, after I add, I will make create. I will take this one. See here, see what I have done. Oh, face, okay, pharmacy 24. Okay, في ناس تشتغلوا ما شاء الله. Some people have done good work. What you have seen here, I will fill the form. See what will happen. Name, any name, okay. Gender, working, no, not working. Can you see? Can you see? Is it right? What shall I do here? Nam? Remove star. Great. What else? Nam? Third option. Good. You are right. To reduce the errors, not all the people will understand if I put it there and If it is sometimes remove the star, some people, they will say working, and they will skip this question. Then you will get lack of data. You will have missing data. What will you do? You got it. In this case, what I have to do, I will go back here. I will get, okay, this one. See how I'll do it? Okay, let's open. Here are the questions, working. Here, working, I have to see how I made the questions. Here, see the data? I put working, okay? If I put 1, 2, I will deal always with this one, values. Values, it goes to the backend. Your data will be filled by this one, not by this one. This is label only for people to see. If I put anything here, anything else rather than working, it will come that items. So here what I have to do, I will take this as a copy this one, copy, and then cancel. I will go here for private sector. Please see here what I have to do. Yes, see? Condition. I have to put conditional. This is true if it is question working status is working. Save. And then after saving, create. And after create, go here and say refresh. See here now? If it is not working, fine. If it is working, he will ask me the question. So this type of things to reduce the errors, to reduce the lack, to reduce missing data. Suppose I want to ask this question only for male, working or not working. Female, I will not ask them this question. Sorry? At home, they are doing great job at homes. I know that. They are doing great job. You are guys, you are not doing anything. Sorry. Anyway, how we can deal with this kind of things? We have two conditions. Yes?
We will make the condition in the gender female.
Okay.
We'll make it
Okay.
the question, we will make it condition with female.
Great. Mumtaz. What else? What else? See how I will do it. Naam? Okay. We said if he is working as well as male, this question will be asked for, this one, sector, will be asked for whom? Working and male, only. Only. So I have two conditions. How can I do them? See? I will come here. Again, same thing. Research part, okay. See? This is the condition here. This is the conditional. I will delete this condition. I will delete this condition. I will delete this one. And I will go to advanced condition. How advanced condition working? I will make this one gender is male and at the same time and the working status is working. Generate. Take this JavaScript. I can do multiple conditions, not one, 3, 4, 5, 6, and or many things. Paste it and then create. See where I kept it? In JavaScript. And from here I created advanced. I want to make and or whatever. I can make practice. Brackets. You can see the brackets here. Okay? I will take this one here. I'll finish. Save. And then always after anything you have to make create. And then see here how it will look like. Refresh. You got it? Female working Male not working, male working. Okay? This will increase the data efficiency. You will minimize the type of errors. How many, I mean, the amount of errors. I have to stop maybe. Am I right? Huh? Yes, yes. Anyway, you can use, I will make this trial for open for you. You can use it as a trial till we find a way. I think you, all of you, fill the form that I have at the beginning. I said no need. I said later on I will send you. We can make a presentation online if you want, or I can send you a username password through your emails that you can use the Stibian. And for any collaboration, you are welcome. Any discussion, you are welcome. Analysis. Yes. For analysis of the data. Data analysis, yes. What you want exactly?
Basically, because many of our students in final year, they are doing projects related to surveys.
Okay.
So they would need somebody to analyze their data.
No issue. We will find somebody in our company. Yeah, yeah. If we can advise them. We can make some sessions with them. No issue. It depends on the data. How many usually? How many? The sample size. Always you are doing. 100. Okay. It's on exercise. Am I right? It's not for decision making.
It's for dissertation.
Dissertation, but not for making decision.
No.
Graduation purpose.
Graduation purpose. It's okay, fine. No issue. Because one of our pillar is data analysis. Okay, so trial 4 will be with you till I stop it. I will inform Dr. Sumaya. And also, if I don't know who is faculty, who is not, I didn't put it there. So anyway, I will check with Dr. Sumaya later on. Then we can send you a username and password. You can use the Stibian. No issue. Okay, that's it. Shukran jazilan. Thank you very much.
Thank you, Mr. Hamid. And now I would like to invite Dr. Sumaya Al-Kindi to propose votes of thanks.
Assalamu alaikum, everyone. It's given me a great pleasure to deliver the vote of thanks as the organizer of this event. Thank you to our speaker, Dr. Amna Al-Hashar and Mr. Hamid Al-Musharfi, for sharing their knowledge, experience, and delivering valuable information, which I think I think, have answered some of your questions and make some of you rethink your perception about research and sustainability. Thank you, Prof. Khalid Al-Belushi, who is the convener of the symposium, for his constant support and guidance and encouragement. Dr. Alka Ahuja, Head of Pharmacy Program, and co-convene of her advice and facilitating through the perception of the symposium and throughout the 2 weeks. Also, thank to the faculty, lab instructors, training supervisors for their unconditional support in fulfilling all the duties and responsibilities which made the symposium possible. An regular committee, logistic committee, scientific committee, risk committee, food committee, thank you all for all your support. I would like to thank also Mr. Sultan and Mr. Yunus for their support to making the design of the logo, theme of the research symposium, and for documenting this event. And also thank you for the quality department for designing the feedback, which I will share the code, so please all of you, you have to scan that code and fill the feedback. Lastly, I would like to thank to all students and participants for making this symposium worthwhile. Until the next symposium, I hope you all stay safe and continue your research endeavor with all gusto. Thank you.
Thank you, Dr. Sumaya. I would like to invite everyone to join us for some refreshment. The student refreshment are in the lobby, and staff, faculty, and guests are in the boardroom.